Ready? Boo!
On September 3rd of 2023, Dominique Hackey and his wife received some startling news about one of their twin sons who was in the NICU at Henrico Doctors Hospital.
A nurse was standing over Noah and was swaddling him and just kind of looked back at us and was like, hey, I noticed that his left leg was not moving. It was kind of discolored. Told the doctor on staff. We got some x-rays. We determined that he had a fracture to his leg, so we are going to splint it for the next 2 weeks.
While Hackey's mother, a longtime NICU nurse, felt the injury was suspicious, Hackey says hospital leadership suggested it was accidental.
That's what they told us, that it could have been done because an injection was given and maybe they did it too hard and that caused the fracture.
3 days later, hospital staff found another baby with bruises on both of his thighs and a left radial buccal fracture. According to this heavily redacted report from the Virginia Department of Social Services, a NICU doctor told a Henrico police investigator that she contacted the NICU's medical and nursing directors about that infant's injuries and placed an alert in the risk system. She then shared the results with 3 different radiologists and the baby's mother. The radiologist told the investigator that they told the NICU doctor that this type of fracture raised suspicions for non-accidental trauma. One of them said it was, quote, not normal, and he had never seen this before with a child who had not left the hospital. Another radiologist said he reviewed images of 3 babies and said he had never seen anything like this in his career. The NICU doctor told the detective she had asked her medical director if they should call Child Protective Services about the injury, and she said he told her it would be taken to leadership and looked into by the NICU nursing director and the hospital's chief medical officer.
How many more people need to tell you that it's abuse or negligence before you do something? That it doesn't make sense to me.
By September 11th, the chief medical officer had a Zoom meeting with a 4th radiologist. That radiologist told police he reviewed all the images and had never experienced anything like this in his 25 years. He said he thought that a pattern of abuse was going on, whether accidental or gross negligence. In total, 4 babies in Henrico Doctors NICU were found with fractures between August 5th and September 18th of 2023. And yet, the medical director for the NICU told the HPD investigator that when the medical team spoke over the phone about the fractures, quote, nobody in that conversation was convinced that these were intentional. He said he, quote, still believes these occur in the normal realm of care and said NICU babies are, quote, medically fragile in a way that people don't understand. Still, he said it does, quote, bubble up a concern for safety in the NICU. According to this report, none of the doctors or nurses the detective interviewed contacted CPS about the fractures. State code requires doctors and nurses to report suspected child abuse or neglect to social services within 24 hours. It was not until September 21st, more than 6 weeks after the first baby was found with a fracture, that the hospital called CPS. The state later cited the hospital for failing to report suspicion of child abuse within a timely manner.
It's hard. Being in a NICU environment is challenging.
We spoke with Dr. Nasim Gorgi, who is a neonatologist in the Boston area. While she does not know the medical details of these cases, she says it's important for people to understand that NICU babies are incredibly fragile.
In your experience, how frequently are you seeing babies in the NICU with fractures?
Babies who are born early, they're at risk for metabolic bone disease and essentially demineralization of their bones. It's not uncommon in the NICU, but I can't tell you that every baby who's born early necessarily has fractures. There are usually reasons why we're getting x-rays and finding these things.
Gorgi also says she is not surprised the hospital or the doctors who reviewed the images and the babies did not call CPS right away.
When you see a fracture, you're seeing a fracture on an x-ray, but it doesn't necessarily give you the history that got there. So I can understand why people would want to be very certain and really look at all the details of the cases and the babies before contacting CPS, because there are other reasons why babies can get fractures.
When CPS began investigating, they learned the hospital's lawyers had already done an internal probe. That investigation determined that a nurse named Erin Strotman had had contact with all the infants in the time frame identified. The hospital placed her on paid administrative leave. On September 26, 2024, CPS determined the infants had been abused, but found there was not sufficient evidence to say Stroutman was responsible. Henrico Police and the Commonwealth's Attorney's Office closed the case. According to prosecutors, the hospital brought Stroutman back to work that very month. Several weeks later, more babies began to suffer mysterious broken bones in the NICU.
This is an institution that's supposed to protect the most innocent human beings, and they didn't. And for the life of me, I can't understand why.
The hospital says they found 3 babies with fractures in November and December of 2024 and reported it to the proper authorities. The Virginia Department of Health suggested Henrico doctors stop new admissions to the NICU, which they did on Christmas Eve. On January 2nd of this year, Stroutman was charged with abusing one of those babies. This criminal complaint says video evidence from November 10th of last year shows Stroutman applying pressure to the then 5-month-old infant's legs, placing her weight down on the legs of the baby, and then taking both legs and pushing them backwards to where the baby's feet were at his head. The child looked to be crying and in distress.
Prior to video existing, people were charged with crimes. They were charged with malicious wounding. So do you feel like the county did everything they possibly could to investigate in 2023 and try to find evidence of who the perpetrator was at that time?
Again, I don't want to comment specifically on the findings of 2023 or how it came to be that agencies came to certain findings in 2023. What is important for the public to know is that everything that happened in 2023 is in fact part of an ongoing investigation today.
To say the birth of Michelle and Jake Salmons' second son at 38 weeks and 6 days did not go as planned is an understatement.
He was born without a heartbeat. He wasn't breathing. His APGAR score was 1.
I think they could have just declared him dead.
On November 15th, 2023, Michelle's uterus ruptured while in labor at Henrico Doctors Hospital, leading to an emergency C-section delivery and rescue operation.
They did CPR and assisted breathing for 7 minutes and brought him back to life.
Yeah.
And that was the start of his life. So.
But he's here.
He's here.
Little Harvey suffered catastrophic brain damage and will live with the impacts for the rest of his life.
This brain injury has resulted in a diagnosis of cerebral palsy. He's only 14 months old. He has a diagnosis of infantile spasms, which is a form of epilepsy. He's fed only by a G-tube, which is a feeding tube, so he does not eat by mouth.
Last May, Michelle put a help wanted ad on Facebook in the hopes of finding in-home nursing care for Harvey. She interviewed several nurses before finding the right one. Michelle never thought twice about the other applicants until early January.
I texted my husband, Jake, and I said, I interviewed a girl named Erin from Henrico Doctors Hospital. And almost immediately that text came back and he said it was her.
That would be Erin Stroutman, a nurse now charged with abusing a baby in the neonatal intensive care unit at Henrico Doctors.
And I just shook. I had that mama bear reaction where all I wanted in that very moment was, I feel like I'm shaking just sitting here thinking about this.
Michelle showed CBS 6 the Facebook messages and texts she exchanged with Stroutman in late May and the notes she took during a phone interview with her.
I'm currently off on leave right now for personal reasons, and I have a lot of extra time. I could provide references from coworkers or managers.
But Michelle said Stroutman also made some troubling comments about the hospital.
She told me things such as they were cutthroat, and I say that in quotes because I have it here in quotes. She told me that they like to heal you, aka the patient, and then kick you out. And then she also mentioned that the quality of care gets overlooked.
And there were other statements that made Michelle question if Stroutman was the right candidate.
Here, she also told me in this phone call that she was on personal leave, telling me she had a condition called POTS, either that is or in addition to a heart condition. She told me specifically that her heart rate was high when she was standing, and therefore she had trouble working the 4 12-hour shifts that were required of her to be in the NICU.
But here's the thing, Stroutman was actually on paid administrative leave at that time. The hospital forced her to take it after an internal investigation into fractures suffered by 4 infants in the NICU in 2023.
We now know that she was dishonest in her messages and conversation with Michelle.
In a recent court hearing regarding the criminal charge Stroutman now faces, Henrico prosecutor Allison Martin said that another family has come forward to report Stroutman offered nursing care to their child while she was on leave. Martin says Stroutman told that family she was on leave due to tuberculosis exposure.
It's despicable that she could have come into our home or gone into the home of others. Why? Why did you not do something sooner?
Child Protective Services and Henrico Police investigated the 2023 cases, and CPS determined the infants had been abused, but found there was not sufficient evidence to say Stroutman was responsible. The hospital brought Stroutman back to work in September of 2024. Several weeks later, 3 more babies suffered mysterious broken bones in the NICU. Investigators say Stroutman was caught on camera abusing one of those infants in November. Martin says more charges are coming.
Honestly, I felt like we dodged a monster coming into our home and caring for our baby.
Now, the Salmons family says they are calling for more transparency from hospital officials, saying they owe it to the community.
I think there's a lot of unanswered questions that Henrico Doctors Hospital still needs to answer for the public and for families like ours.
And families of babies who were impacted when their child was in the NICU.
Matthew Whitfield's wife nearly died when she unexpectedly gave birth 9 weeks early on October 29th of last year at Henrico Doctors Hospital.
There was a point in time where I thought I lost both her and my daughter.
At first, he had to split his time between his wife, who was recovering, and his daughter, who was in the NICU at the hospital. And he says he implicitly trusted the staff in the NICU.
We thought it was one of the best in the area, if not the state, and thought that there's no safer place for our baby and my wife.
But according to 2 scathing new reports from the state, the hospital failed to implement actions to prevent abuse or protect patients from abuse and neglect. The reports detail the results of an investigation that was launched after the Virginia Department of Health learned that multiple babies had suffered broken bones in the neonatal intensive care unit of Henrico Doctors Hospital late last year. The VDH Office of Licensure and Certification probe began this past December. The day after Christmas, CBS 6 was first to report that the hospital had posted an alert on its website saying that NICU admissions were being paused and that safety measures were being updated due to, quote, unexplainable fractures. Since that time, a nurse named Erin Stroutman has been arrested and charged with multiple crimes against 5 premature babies, including abuse and malicious wounding. Whitfield says Stroutman was the most consistent nurse tending to his baby within the first 2 weeks of her life.
We thought she was great. We never would have thought it was Erin.
The state investigation confirms previous CBS 6 reporting that Stroutman, referred to in the report as EMP-11, was actually placed on administrative leave on September 10th of 2023 after 4 different babies that she had cared for suffered mysterious fractures. Those injuries were identified between August 5th and September 5th of that year, but were not reported to Child Protective Services until September 20th. According to the report, when the state investigator asked why CPS was not alerted within 24 hours about suspected abuse as required by law, another hospital employee, quote, indicated that the facility conducted their own initial investigation and then determined the facility would report the possibility of abuse. At that time, the hospital agreed to put certain safety measures in place to ensure more babies would not be injured. They installed security cameras in NICU rooms and implemented daily head-to head-to-toe assessments of all patients to look for any suspected signs of abuse. But inspectors found the hospital did not review video from the cameras and discontinued the head-to-toe assessments in the summer of 2024 without approval from executive leadership.
Do you think that that should have been in place from the beginning, to have some sort of maybe random review of footage?
I think that would have been helpful. I think it would have been helpful for the hospital to have been reviewing the footage of at least Erin, if they knew that she was potentially a suspect for what happened in 2023. I don't know why there wasn't more oversight of her work.
Stratman was allowed to return to the NICU a year later on September 17th of 2024 after the CPS investigation found that abuse had taken place, but they could not identify the abuser. The report states that upon returning to work, Stratman had to complete abuse and neglect training and work alongside a supervisor called a preceptor. During an interview, another hospital employee told the state investigator that after 3 days with the preceptor, the hospital had no concerns with Stratman's care.
Well, it is shocking to me that the hospital didn't do more, that they let her come back, that they let this happen again. I don't know how this happens twice.
Less than 2 months later, on November 10th, surveillance video showed Stratman holding one of the babies without supporting the head and neck, and also quickly twisting the infant's head with one hand while the infant was lying on their back. That same video showed Stratman, quote, forcefully pushing the infant's legs towards the abdomen with the feet almost touching the infant's face. 3 days later, according to the report, video captured Stratman forcefully inserting a suction catheter into the baby's nostril and inserting it deeply. Another employee told the investigator it was the incorrect type of suction device for the nose. Ultimately, the state investigation found that the hospital failed to prevent child abuse for 7 NICU patients, though, as we said, Stratman is currently only charged with crimes against 5 children. While there is no evidence to suggest Whitfield's baby was ever harmed, Whitfield says he is still haunted by what he says was a lack of communication from Henrico Doctors Hospital about what happened.
We were in the NICU. We had her as a nurse. At any time, they could have told us what was going on, and they never did.
Dominique Hackey demands change after his son Noah's leg was fractured inside the NICU at Henrico Doctors Hospital in September of 2023.
These institutions need to be able to be held accountable for when they're not doing things right.
Former NICU nurse Erin Stratman is currently facing charges related to Hackey's son and several other babies who were injured in the NICU. The state health department cited the hospital for failing to prevent abuse or protect patients from abuse and neglect, and for failing to control an outbreak of the antibiotic-resistant infection MRSA in its NICU for over 3 years that infected 94 babies. But neither VDH or the federal agency that pays for Medicare and Medicaid has the authority to fine hospitals for those failures.
That's unacceptable. Like I said, the delegates, the representatives, they need to get involved because at this point it's too much. It's too many system failures that are affecting lives. It needs to stop.
But the Centers for Medicare and Medicaid does have the authority to fine nursing homes for health and safety noncompliance, and the Virginia legislature just passed legislation to allow VDH to fine nursing homes.
Do you think that the state should have the ability to impose a fine, a financial fine, if they find wrongdoing or deficiency?
1,000%. They need to come up with laws, regulations that hold these institutions accountable.
Delegate Rodney Willett, who represents the part of Henrico County where Henrico Doctors Hospital is located, said while the state and the federal government cannot issue fines, they can pull their license to operate and deny Medicare and Medicaid payments.
Some might argue there should be something in between that we can do to try to force accountability here, to try to force change, as opposed to pulling a license or pulling Medicare, Medicaid funding. We need something in the middle
That is an absolutely true point. And I can't speak for all hospitals. I can definitely speak for Enrico doctors just because I've had so many conversations with them, with their leadership. And I think any threat to accreditation, to licensure, to funding absolutely gets their attention. And I think that in itself is significant. And that's not to say that we couldn't, just like we did with nursing homes, we as the legislature couldn't revisit the fines. I just don't know where, in this context, where that would get us.
Now, I did learn that some other states allow their health departments to fine hospitals for health and safety issues. For example, South Carolina and New York. I'm Melissa Hippolyte for CBS 6.
I think there's a lot of unanswered questions that Henrico Doctors Hospital still needs to answer for the public.
Those questions raised since January by impacted families and others in the greater Richmond community after the state found HCA's Henrico Doctors Hospital failed to protect patients in its NICU from abuse and neglect and failed to consistently control the transmission of infections within the hospital.
This is an institution that's supposed to protect the most innocent human beings, and they didn't. And for the life of me, I can't understand why.
Former nurse Erin Strautman has been charged with hurting multiple babies in the NICU in 2023 and 2024. And the state has also found a MRSA outbreak in the NICU infected 94 babies over 3 years. But many questions remain, including why did the hospital not contact Child Protective Services right away after finding infants with unexplainable fractures in 2023? Why did the hospital bring Strautman back to work after an internal probe led to her being put on administrative leave for an entire year?
Well, it is shocking to me that the hospital didn't do more, that they let her come back, that they let this happen again. I don't know how this happens twice.
And how was a MRSA outbreak able to persist in the NICU for so long?
It makes me very mad because there's no way 2 years later that this should still be going on.
Should it have been, in your mind, all hands on deck to try to get this thing under control? Or is it okay in your mind that they let it go for 3 years?
No, it's not okay that they let it go.
CBS 6 has sent countless emails to HCA asking those questions and requesting the opportunity to interview the CEO, Ryan Jensen, but our requests have either been declined or ignored. So we tried to ask Jensen ourselves at a recent groundbreaking event. Are you willing to do an interview right now?
I'm happy to talk about this today.
Can I ask you a few questions?
I'll leave that to our PR team from a NICU standpoint. We're just happy that we're moving forward and we're good with the state and we're open. But I leave it to our.
I guess the
our
lawsuits are over, so I felt like maybe you'd be willing to talk to me and let me ask you a few questions.
We're talking about the Scott's Walk today, Maggie. Thank you.
And I'm not trying to be pushy or anything. I've asked
is
so
what we
many
have.
times. And I understand that, and my colleague is actually covering this. Like, this is going to be a story in our broadcast today, but
That's great.
I
Thank
did
you,
want
Maggie.
to have the opportunity to ask you a few questions.
Thank you. We're
This is
just
what we're
focused today
excited
on
about
Scott's
today.
Walk. Appreciate it.
Thank you.
Questions can come to me as well.
The Virginia Department of Health told me that Henrico Doctors Hospital is now in compliance with all state and federal rules. They had been operating under a consent agreement, which allowed the state to provide increased surveillance of the NICU. On September 12th, the hospital applied to have their consent agreement removed, and the state did approve that request. In Henrico County, I'm Melissa Hippolyte for CBS 6.
So when it comes to hospital accountability for protecting the health and safety of patients, we do, again, have limited actions that we can take for hospitals.
Addressing Virginia's Joint Commission on Healthcare about hospital accountability, the state's top health official highlighted the Virginia Department of Health's limited powers to hold hospitals accountable for failures.
We can revoke or suspend a license, but it's for the entire hospital, which would be a very drastic situation for healthcare needs, especially in some of our communities that don't have multiple hospitals. We cannot currently impose intermediate sanctions on hospitals at this time.
In her presentation, Dr. Karen Shelton talked about the NICU at Henrico Doctors Hospital, where a nurse was charged with abuse and neglect after multiple babies experienced bone fractures in 2023 and 2024, and where an outbreak of the antibiotic-resistant infection MRSA persisted for 3 years and infected impacted 94 babies. The state cited the hospital in April for multiple deficiencies, including a failure to protect patients from abuse and neglect and failure to control an infection outbreak.
The hospital remains out of compliance. They will be submitting another corrective action plan.
But VDH does not have the statutory authority to impose a fine for the failures, something parents of impacted babies say they disagree with.
They need to come up with laws, regulations that hold these institutions accountable.
Investigating is not enough because 94 babies, that's a high number.
Dr. Shelton confirmed the hospital informed the health department's Office of Epidemiology about the MRSA outbreak right away. And epidemiology worked with the hospital to try to stop the outbreak. But epidemiology does not have the authority to cite the hospital for failures.
Could the Office of Epidemiology contacted the Office of Licensure and said, hey, can you go out and do an inspection because this outbreak is persisting and it's not being reined in?
Well, as we look at the confidentiality of all these matters, certainly the health care of the health of our citizens of the Commonwealth is the most important thing. So we need to make sure that we're breaking down barriers in communication to make sure that we are working together to solve these problems.
Yeah, could it be like the two entities were kind of in silos, maybe not communicating on that issue?
Yes. But at this time, we have had good communication between these offices, and both are working together at this time.
Even if VDH had cited the hospital sooner for failure to control the outbreak, VDH would not have been able to fine the hospital for the deficiency, something the legislature actually gave VDH the power to do this year with nursing homes, and something Delegate Rodney Willett, who represents the area where HCH is located, noted to Dr. Shelton.
So it sounds like we've got a similar gap on the hospital side is what I'm hearing.
Yes, sir.
Okay, something to address.
As the state health commissioner, do you think it would be helpful, or would you like to have that tool in your toolbox to be able to fine a hospital for an ongoing deficiency?
If there were some more intermediate sanctions, that might be helpful.
Delegate Willett told me that he expects one or more bills to be introduced that would give VDH more enforcement options related to hospitals, something similar to what was already passed earlier this year that allows them to sanction nursing homes. In Richmond, I'm Melissa Hippolyte for CBS 6.